Hello and welcome here at London Valves 2023. My name is Philip Lurz. I'm here with my colleague and friend, Jörg Hausleiter. We're here to discuss a bit about the CLASP IID program. Tell us a bit, what does that entail?
Well, the CLASP IID program is the first randomized head-to-head comparison of the PASCAL and the mitral clip system in patients with primary or degenerative mitral regurgitation. And it has two components, a randomized component and the registry, which we'll also talk about. So maybe I'm going to ask you, Philip, can you tell us a little bit about the design of this randomized comparison?
Yes, so as you said, the idea was to compare these two devices really head to head. Sometimes we were tempted to compare results of different registries, but we never know whether the same patient cohort was treated. So this is a proper randomized head to head comparison, PASCAL versus clip, randomized 2-to-1 in, as you said, degenerative MR. There's also a program for FMR, but this is specifically for degenerative MR. And the goal was to show that PASCAL is non-inferior to the mitral clip for mitral TEER.
Then there were, I think, two endpoints. You want to talk a little bit about the study endpoints?
So the primary endpoint for the non-inferiority with respect to effectiveness was assessed at 6 months, but now we here also saw data on the 1-year assessment of the effectiveness outcome, which was mainly the percentage of patients ending up with moderate or less or mild or less MR in the two groups. And to make it short, the results are very comparable between the two devices and treatment groups. In both groups, about 77% of patients ended up with mild or less MR. And that was seen early on, but then also well maintained during the study period at 1 year.
Well, this is a very important outcome.
Yes.
That we're going to see the durability at 1 year. But what about the early complications? Can you also talk a little bit about what has been seen in the trial?
Yeah, it confirms what we always see in registries and other studies. TEER is very safe. TEER on the mitral valve is very safe. So very few complications and very comparable between the two devices.
It's also a very important outcome. But then the final question perhaps is about the clinical outcomes at 1 year in terms of survival, in terms of quality of life.
Yeah, I think that was, as it should be done, thoroughly assessed. KCCQ, 6-minute walking test, NYHA class, and positive and significant signals for all these outcome measures which relate to the actual clinical status. This is why we do the procedure, and we see that reduction MR does also relate in a much better symptomatic and clinical state. Again, no difference between the groups, and also a very good survival rate up to 1 year in these two cohorts. So we said before that those were patients in whom the decision was made that they could be treated either with clip or with PASCAL, but there was also a registry. That was for patients who were not randomized because the decision was, or the feeling was that they might not be suitable for the clip. Can you explain what kind of patients were in that registry?
Yeah, as you already alluded to, is that those patients where the mitral clip could not be used as according to the instructions for use, those patients were then allowed to be treated with a PASCAL device in a single-arm registry, and these were about 100 patients who were enrolled who had some more complex disease on the mitral valve.
In your daily practice, what patients do you see more often, registry patients or randomized?
More the randomized patients, but we do see more and more also these more complex patients where we're also going to need to treat those patients with such a device.
So more extreme anatomy, multi-segment problems, calcifications as well?
Calcifications of the leaflets, B-leaflet pathologies or multiple jets. These were also the main inclusion criteria into this registry arm.
So with more complex anatomies, what was the outcome?
Well, the outcome first in terms of the early outcome, procedural outcome, was that you can treat those patients also very, very effectively, that you get a very good reduction in the MR rates, that the procedure itself is also very, very safe, very comparable to the randomized cohort.
Sometimes we think about TEER patients and suitability for treatment in colors, green, yellow, red. What sort of color patients were in the registry?
Well, the registry probably represents the patients in this yellow group, a little bit more complex patients, not the super complex, but the still significantly more complex than the green cohort, which is probably representative of the randomized arm.
So that's important when we interpret these results. So in summary, we have two devices which are very safe, which allow us to reduce MR to mild or less in up to 77% of patients. And then even those where normally everything is a little bit more complex and TEER might not always be the best option, we see that more than 60% of patients still end up with a good result. So safe and effective devices, both for PASCAL and for the CLASP. Thank you, Jörg. Thank you.
Thank you.